So good day everyone, I am Kevin Terosa and today I will be going to perform my return demonstration on Leopold maneuver. So the first thing to do is wash your hands to prevent the transmission of harmful microorganisms. So I have already done washing my hands. The next thing to do is to explain to the client the procedure. This is done to reduce the client's anxiety during the assessment. Good day, ma'am. My name is Kevin Teroso from Davao Doctors College, your nursing student for today. So kindly state your name and your birth date, ma'am. So your name is Alexandra Venterosa and your birth date is August 16, 1997. Am I right, ma'am? Okay po, thank you. It requires that I will going to palpate your abdomen to determine the position of your baby in your womb. So I am hoping for your full coordination to the entire assessment. The next thing to do is to let the client empty her bladder before the procedure, because a dilated bladder could cause the uterus to slightly deviate, which could produce unreliable results. So ma'am, before we start our assessment, let's just empty your bladder first before starting the assessment, because it can affect the results of the findings. So the next thing to do is I will going to position the client in supine, because this assessment requires this position for accurate findings or results. So ma'am, I will going to position you in supine position po. So the next thing to do is, if right-handed, stands at woman's right facing the patient. This is done to perform the assessment comfortably and uncomplicated palpation. So I have now standing and facing the woman at the right side. So the next thing to do is I will going to palpate the uterine fundus. This is done to determine what part of the fetus lies in the upper part of the uterus. So I will going to palpate gently. So while palpating the uterus fundus, I can feel the lower part of the fetus, which is the feet or the knee of the fetus. So I will going to palpate downward, going to the sides of the abdomen. We gently pressure. This is done to determine the fetal extremities position. So while palpating, I can say that the baby's fetal extremities position is in left occipito anterior, because in my left hand I can feel the maybe the knees and the arms of the baby, because it has a bulb, while the right hand is I can feel the plain body of the fetus, which I can determine that it is the baby's spine or the back part body of the baby. So the next thing to do is I will going to palpate on hand over the symphysis pubis and grasp the lower uterine segment using my thumb and the fingers. This is done to feel the presenting part and very gentle touch to move the head of the baby to determine if the baby is already engaged or floating. With a gentle palpation and a gentle moving the head of the baby, I can say that the baby is floating, not engaged. So now I will going to turn and face the woman's feet. This is done to confirm the findings of the third maneuver and determine the flexion of the vertex after doing the procedure. While palpating, I have determined that I can say that the position of the baby is still a vertex left occipit to anterior. So I have located the back part of the fetus. This is done to listen for the fetal heart tone for 1 full minute using the stethoscope. So I will be going to use the bell part of the stethoscope because it can hear a low pitch sound. So I will going to place now the bell. For the next step is I will going to note the location and the rate and the character for the fetal heart tone. This is done for the record of the assessment. So after doing that is to make the patient comfortable. This is done to reduce the the patient's anxiousness and anxiety. So now I have positioned my patient in a comfortable position. So I will now going to document the observations made, the fetal presentation, position, and the attitude, whether engaged or floating. This is done for the view of findings for the physician.